Most men don't see it coming, not because the signs aren't there, but because the signs start small, stay quiet, and are easy to explain away. A little more tired than usual, waking up once or twice at night, taking a little longer in the bathroom. Nothing alarming, nothing worth a doctor's visit, until it is. These are the early signs of prostate problems most men ignore, and knowing them could be the most important thing you watch today. The prostate is a small gland, roughly the size of a walnut, sitting just below the bladder and wrapped around the urethra, the tube your body uses to pass urine. Its job is to produce fluid that protects and carries sperm. For most of your younger life, it does that job without a single complaint. But after 50, the prostate tends to grow. And as it grows, it starts pressing on the bladder and urethra in ways that create a very specific, very recognizable set of problems. The older you get, the higher the risk, and the longer you wait to pay attention, the fewer good options remain on the table. So here are the signs. Pay attention. The first is frequent urination, especially at night. If you're waking up 2, 3, for times between midnight and 6 in the morning to use a bathroom, that's not just bad luck or too much water before bed. That's a pattern. Medically, it's called nocturia. And in men over 50, it is one of the earliest and most consistent indicators that the prostate is enlarging and beginning to press against the bladder. During the day, the pattern shows up differently. Needing to go more often than feels normal, making mental notes of every bathroom location wherever you go, trips that feel urgent but deliver less than expected. Your bladder is not in charge of your schedule. If it's starting to feel that way, something has changed. The second sign is a weak or slow urine stream. This one is deceptive because it tends to develop gradually. So gradually that most men don't notice the shift until the stream has become significantly reduced from what it once was. The brain adjusts to a new normal without flagging it as a problem. But if the flow is noticeably thinner, if it takes effort to maintain, if it stops and starts rather than flowing cleanly, that's the enlarged prostate narrowing the urethra and restricting what can pass through. The pipes haven't changed. Something is pressing on them from the outside. The third sign is closely related but distinct enough to name separately. Difficulty starting urination. Not a weak stream once it begins, but a delay before it begins at all. You're ready. Your body is not. You stand there, willing things to happen, and there's a pause that didn't used to exist. This hesitancy, that waiting period between intention and result, is a direct signal that the urethra is being compressed and the bladder has to work harder than it should just to initiate flow. It's one of the earliest mechanical signs of prostate enlargement, and most men who experience it assume it's just a quirk rather than a symptom worth reporting. Fourth, the feeling that your bladder never fully empties. You finish, you step away, and within minutes the sensation of needing to go returns. So you go back, and it happens again. This is because when the prostate restricts flow, the bladder can't fully expel its contents. Urine stays behind, the bladder registers it, and the signal keeps firing. Beyond the inconvenience, retained urine creates a warm, stagnant environment that bacteria find inviting. Urinary tract infections in men are far less common than in women, but incomplete bladder emptying is one of the primary reasons they happen when they do. The body is not being dramatic. It's accurately reporting a problem. Fifth is sudden, intense urinary urgency, the kind that arrives without much warning and allows very little time between the signal and the point of no return. Not the gradual, manageable build of a full bladder. A sharp, immediate pressure that says now, not soon. For some men, this urgency comes with accidents. Quiet, humiliating, confidence-eroding episodes that get managed privately because bringing them up feels impossible. The prostate's proximity to the bladder means that when it's enlarged or inflamed, it can trigger bladder contractions independent of actual fullness. Your bladder isn't lying to you. It's being sent faulty signals from a gland that needs attention. Sixth, pain or burning during urination or ejaculation. This one gets its own short paragraph because it deserves clarity. This is not normal, it is not aging, and it should not be waited out. Pain during urination, known as dysuria, can indicate a urinary tract infection, prostatitis, or other conditions requiring prompt treatment. Pain during ejaculation is similarly significant and similarly underreported, often because men find it too uncomfortable a subject to raise. Whatever the cause, pain in these contexts is the body sending a clear, unambiguous message. The right response is not to manage it quietly and hope it resolves. The right response is a doctor's appointment. Seventh, and this is the one that should end any debate about whether to seek help, is blood in the urine or semen. It is uncommon. It is alarming when it occurs. And it absolutely warrants immediate medical attention, not a search engine and a few days of monitoring. Blood where it should not be is one of the strongest signals a body can send. It does not always mean cancer. There are less serious explanations, but it means something, and only a physician with proper diagnostic tools can determine what. The instinct to avoid the appointment out of fear is understandable. It is also the worst possible response to a symptom this significant. Behind these signs, 3 conditions are most commonly responsible. The first and most common is benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate that affects a majority of men to some degree as they age. Benign doesn't mean harmless. Left unmanaged, it can significantly impair urinary function and quality of life. The second is prostatitis, inflammation of the prostate, which can be bacterial or non-bacterial, acute or chronic, and produces many of the same symptoms as BPH along with pelvic discomfort and sometimes fever. The third is prostate cancer, the one that sharpens everyone's attention, which is common, often slow-moving, and when caught early, highly treatable. These 3 conditions are distinct. They cannot be told apart by symptoms alone. That's the doctor's job, not yours. That's the doctor's job, not yours. When should you go? Now works. If any of these symptoms have been present consistently for more than a few weeks, if they're worsening, if there's blood involved at any point, if the disruption to sleep and daily life has crossed from minor to significant, the threshold has been crossed. A PSA blood test, a clinical examination, a straightforward conversation with a urologist, these are not dramatic interventions. They are the minimum a man over 50 should be giving himself. Catching a prostate condition early, whether it's BPH, prostatitis, or cancer, changes the treatment options available and changes the outcomes that are realistic. Catching it late does the opposite. Early detection saves lives. That sentence gets repeated so often it starts to sound like wallpaper, something you hear and stop actually processing. But it is simply factually true. Men who respond to early symptoms get better outcomes. Men who wait get harder conversations. The choice between those 2 paths is almost always made before anything serious has happened, in the quiet window when symptoms are small and easy to dismiss and doing something about them feels optional. It is not optional. It's just quieter than it will become if you wait. Subscribe for more videos built specifically around protecting your health after 50. Share this with someone who needs to hear it and won't go looking for it on their own. Like the video if it gave you something worth acting on. Your body has been working for you every single day without asking for much. A little attention, a little early action. That's all it's asking for now.